with a couple of teeth that we have to restore. They're going to be independent crowns. This is an implant case, of course. And here's what it looks like when you start off your case doing the abutment choices. It's hand articulated. This person has a very nice bite. Let's get these out. My little lab bench area here basically has the tools always available to deal with the abutments, the impression copings, anything you need to do here. It's not an elaborate setup. It doesn't need much, just needs a few burrs here and there. But let's see. So that's what it here it looks like. I look at the depth of this to the top of the analog and the gums. I've got on the short end maybe 2-3 millimeters. On the long end probably about 5 maybe here, but short here. So you can choose an abutment that'll be tall and then you grind down to the margin, or you take one short and then clinically you got to push that tissue back with the crown. Either or works. Here it looks like there's a little bit of a defect. I don't know if that's the tissue that needs to grow up, and that's clinically, that's the tissue that will be filling back in closer to what's here. If that's a pour-up defect or an impression defect, then I expect that the tissue be closer to the heights here, not what this is. So that's how I judge that. Overall, looks nice. I got a premolar here and then a molar here. So that works. Here's the hand articulation. That'll work great. And when we look at the scanner, that's what we'll do. We'll just rubber band the bite together like this. So we'll grab a couple of the abutment choices. We have, here's a tall one. These are all internal hex. It's always nice to stay with one system. Let's see. Looks like there's already a screw in there. All right, so let's go with the tall side first. Get that in, and we can kind of put it down here. What's nice here is that margin goes right under the gums. It's fairly nice. And then we have this little bit here to do that. So that's pretty much perfect. And the next one, I'm going to pick a shorter one. I like to be a little bit below the gum line because the gum line it's expanded a little bit with the material here. And so I expect that the gum tissue clinically is going to be lower than what you see here by about 0.5 millimeter at least. So here's an abutment that has a high side and a low side. Just in case, we're going to safeguard ourselves clinically. So I'm going to put the low side where that so-called defect is. Let's see how this looks. And you can always take out it seems a little too deep on all sides, so it's pushing off. You can take this out. So if we want to do that to make it a little bit easier to see how the abutment fits, that's fine. I usually don't take it out because it's harder to get actually in the way it was in when it's poured up. But you can take it out, try it in, check your margins with the crown, but I wouldn't take it out right now. But you can push this down and it'll go in there. Just clinically, you might have a little bit of an issue once it goes in. You can see how much further down the margin is that I don't really want to see that. So this one might be a little bit too short. So let's find a different one. This one's a little taller. Looks like we're just about out of those. Yeah, it looks like I'm right. Gotta just double check that I got the actual the hex engaged properly. So that feels good. That's pretty good. So I'm just below the gum line here all the way around. I'm okay with that clinically. You can push the tissue down clinically. I don't have to worry about prepping that one at all. The only thing I have to prep off this one is the height, and I'll probably put it flat side so that the crown has a little bit more indexing than a round circular. Well, I find that clinically, if you just had a cylinder like this and you had a ceramic crown on it or something, it's too rotationally problematic clinically over probably a year or less. You'll probably have the patient biting and grinding, and the little rotation turns there will overcome any friction that you have with your bonding of your cement to this. So if you're going to have a round cylinder type of situation where you don't index it for the crown, you're in jeopardy of that crown just coming loose. And the second thing is that anytime you want to increase the retention, you basically want to air braid this. You want to make it really frosty. You don't want to leave it all shiny. So you want to abrade this down so that your cement will bond to it a lot better. Okay, so here's another thing. We need to adjust the occlusion, and I'm pretty much biting all the way around, and I'm just hitting it. So here I have a little bit of clearance, not enough for the porcelain crown I want to do, and not enough here either. So we're gonna cut it about here. What you can do is just take a little marker and mark it where you want. I mark it, you know, in the occlusal plane. I don't mark it parallel to those lines. And then I want to mark this one here too. So I want to take off a good amount of that, good amount of that, maybe even back a little bit more. You got plenty of room for that. So that's our mark. The first thing I want to do is index it though, because I like those placements. Here's a burr that I use. It's a very coarse one. It works really well for abutments versus like a non-coarse one. Here, this is, you know, good for polishing things down a little bit. You can probably work with the titanium too, but I like this, and I like the nice chamfer that will put on it. Nice and aggressive blade there, or carbide. So let's adjust this margin here. Okay, now this handpiece is just a handpiece I got off Amazon, probably for $15–20, or maybe a little bit more, I'm not really sure. But these are used in beauty salons. So you don't have to get everything that's made for dental per se. And they work great. I haven't had any problems with this one. I've had other ones that I have had some problems with, but in particular this one seems to be pretty good. And I use it for lab work, so that says a lot because I put a lot of pressure on it. And now I'm going to just finish up the margin. I go a little bit into that gum tissue because I know I want to get below it. I know that there's more expansion here than in the mouth, so I definitely want to be below the gum line here. So I'm going to just cut right into that when I get to that point. You always try to stay pretty much parallel with this, just like any other prep. You don't want to cut in to the margin because now you have an undercut. You want to stay with that profile as much as possible and get a nice chamfer. And you want to see that here. So let's keep doing that. And let's get the index in here. A lot of labs. A lot of labs will do, if they have two abutments, they will do one dot and then two dots, or they'll somehow mark it. Sometimes they mark it on the stone as well. This is in case it's not you doing the work. You put one dot here and then two dots here, just so you know, or that your assistant knows that that one goes there, one dot, two dot. Just explain to them that that's on the facial side. It's pretty straightforward. All right, so here's another tip. I have a little simple grinder I got from Harbor Freight. Doesn't cost much at all, really cheap. I don't have to go to the dental labs to get a little grinder, and I don't like to use my handpiece and overwork it. So I always have analogs nearby, and now to take that off, either I can use my handpiece or I can use something way cheaper and more robust to grind it.